Even simple things like Tylenol and ibuprofen are very useful to them there because they may not be available in the stores or the patients may not be able to afford them. I'm Dr. Leslie Pittman and I go to Pittman Park United Methodist Church here in Statesboro. This will be my 4th medical mission to the Dominican Republic, to the area outside Verona in the Dominican, and I'm very much looking forward to going. We take a medical team down and it consists of doctors and nurses and sometimes other medical personnel as well. We all help out by treating just whatever medical conditions the people have down there. We're only down there for a week and we'll do everything that we can do to help within that week. But for patients who need longer term care, we try to get them in touch with the local doctors who are willing to volunteer their time. Certain parts of the Dominican Republic are very lovely and tropical paradise type areas and actually have a pretty good medical system, but the places that we go to are far out away from the cities, mostly in the sugarcane field, and it's people who work very hard labor jobs. They have no money and therefore they cannot get any medical care that is not donated to them, basically. So things like mission medical care is all that's available to them. The housing situation is often very minimal. There are still people who live in houses made out of palm tree bark, and also many of them are short of food. Malnutrition is a major problem there. There are a few government-funded clinics in the areas, but even where there are, they often don't have medications for the patients. The patients cannot get to the cities to buy medications at the store. So some of them will bring us the medications that they had from the last team that came in, and we'll try to match them to the best of our ability. Even simple things like Tylenol and ibuprofen and Pepto-Bismol are very useful to them there because they may not be available in the stores, or the patients may not be able to afford them even if they were available. Simple things that we sort of take for granted here can mean a lot to patients down there. We're asking for over-the-counter medications like Tylenol, ibuprofen, vitamins, both adult vitamins and children vitamins, and also asking for different allergy medications, stomach medications. There's quite a long list. Something that we started doing last year, we have what are called hygiene kits that have just basic hygiene items, things like combs and brushes, washcloths, soap, toothpaste, toothbrush. We don't always think of hygiene as being part of health, but it definitely is. Just the difference in being able to wash a wound with soap can mean the difference between getting a pretty serious infection or turning out to be okay. Dental hygiene is very important for preventing other more serious infections as well. The travel size are actually perfect for the hygiene kit. We will pack them, they will go in our checked luggage, and we will take them down there. When we get down to the Dominican Republic, we will portion them out into appropriate amounts with the instructions on them and the name of the medication so that the patient knows what they are for. Usually we'll keep the medications in big plastic crates and we'll sort the medications from there. They'll be divided up into different types, and our pharmacy crew will help to pick out which medications the doctors have prescribed for the patients. The hygiene items also come along with this. We package them up into little kits and we give them out to whichever patients seem to need them the most. In Backtake 7, there's a clinic that we leave the extra supplies at. Different other mission teams will go down there and use those medications. And we also have a Dominican doctor, Dr. Flory, who also goes out to the clinic 3 days a week to help see patients when we aren't there. So even though here we have more that's available for medications and more available for follow-up and more specialists available, to be able to go and help people who truly are in need and to know that you have helped them is really a wonderful thing.